When I first got exposed to it during residency, it was something where you saw how it affected that person socially. A lot of them, if they were working, did not want their bosses knowing. That group of people, they're still discriminated against. People think, oh, if they sneeze on me, I could get HIV, or if I sit next to them, they may give me HIV, or I don't want to get AIDS, and it's just a lack of education. What I saw over the years, a lot of fear in the patients in and of themselves of, okay, once they got diagnosed, you had to be really careful how you told them because it was a death sentence to them. Oh, I remember when I was working in Chicago, there was a young lady, she was pregnant. Her HIV screening test came back indeterminate. Her provider, my colleague at that time, he told her bluntly, you've got HIV, you've got to do blah, blah, blah. She was 16 years old. And so my staff were like, Dr. Baker, can you please take over her case because this is not right. And so for me, wanting to make sure that things were done right, things were done fairly, and working with that patient and her mother and say, okay, you know what, I can't tell you that you definitely have it until we get back this particular test called the Western blot. So when it came back, it was negative. It was only because she was pregnant that she had a false positive. People are exactly that, people. They're not a piece of paper. They're not an organ where you just kind of focus in on their liver if it's failing. They're people. And you've gotta step back and letting that person know you're there for them. You hear them and you're gonna do what you can to help.